My name is Matt Blois. You're watching Medically Necessary, a show about the healthcare supply chain. I talk with experts, business leaders, and researchers about how we get drugs, devices, and medical supplies to healthcare providers and patients. Today I'm talking with Thomas Teig, the CEO of the nonprofit medical distribution organization Direct Relief, which operates across the U.S. and in 80 other countries around the world. The organization delivers medical supplies or drugs to sites of natural disasters like hurricanes or earthquakes, but they also deliver necessary medical supplies on an ongoing basis to healthcare providers who just can't afford to buy them. So transporting supplies in the aftermath of a disaster is already super challenging, but then the COVID-19 pandemic really upped the ante a little bit, made that quite a bit more challenging. I mean, where do you send supplies when the disaster is everywhere? So on the show, I'm going to be talking to Thomas about, what some of the challenges are with distributing medical supplies in the middle of a global pandemic, and maybe some of the lessons that the private sector might learn from this supply chain for humanitarian aid. So thanks so much for joining me on the show today, Thomas. I think one thing that would be a good place to start, just because I think probably the viewers will be sort of familiar with this, is if you could give us sort of like a comparison of what you do, and then compare that to like some of the commercial players that viewers might know, like Cardinal Health or McKesson, GPOs, distributors like that. Like, what is it exactly that you do?
Well, first of all, thank you for having me on, Matt. My pleasure. And as a humanitarian health organization, that's sort of our purpose. But functionally, we're accredited as a drug wholesaler in all 50 U.S. states. We were the first nonprofit to actually get that accreditation. And the reason we did that in the U.S. was because there's a chronic gap of things that just aren't filled through the normal commercial channels or through government programs. So I think on the one hand, we are accredited as a drug wholesaler, so the distribution function is inherent. But, there's roughly analogous, I think, to a group purchasing organization, except we don't purchase a lot. I think we work with a lot of the manufacturers that look to Direct Relief as a means for them to conduct their charitable activities through a commercial grade system. The controls are important for obvious reasons. So we aggregate supplies, medications, and other types of medical supplies on behalf of the partner organizations that we qualify and approve, and are basically trying to do on an ongoing basis, seeing what is not met through the normal commercial channels or through government programs for public assistance. So it's a blend of probably a few different types of commercial organizations, but we run a distribution center, it's accredited, we have accredited big cold chain facility. So, we look to do it the way that commercial operators do it. The main distinction is we do it for people who don't pay. But there should be no lesser standard, because people aren't in an unfortunate situation when it comes to handling the medications that they rely on, just like everyone else.
Yeah. Well, and I think that's, so you guys, it sounds like you guys are sort of in the middle there of, people who need medical supplies, and people who, either make medical supplies or have medical supplies. It sounds like you have relationships with both sides. You have the relationships with sort of the companies that have material they want to give to people who need it, to situations that are really needing supplies, but they might not necessarily have the information about like how to get it there, who needs it, how much and where. And then you guys also have the relationships with like, okay, such and such medical provider in this place, they're running out of this material, so we're going to go to the manufacturer over here who we know who has it. Sort of making those connections and making sure, like you said, the manufacturer can trust, okay, if we give it to Direct Relief, it's going to get to, it's going to actually be put to the use that we want it to be, that we would like to see it used for. And then on the other side, that you're making those connections there to do that.
Yeah, and I think, the other analog, I think for a manufacturer, you're concerned about the size of the demand, right? And the demand in the commercial setting is, commercial demand. Like, it's not to give it away. It's like, at what price can we sell how many units and be profitable? I think where a normal business would stop looking, no one wakes up and says, let's find out who can't and won't buy our product because they don't have any money. I mean, that's not kind of a bad business move. That's sort of where we start. And we were trying to assess the the human demand that never really expresses itself in the form of a purchase order. They don't have money. And so it's an elusive, there's a market research-like function that's essentially a demand analysis of what is being unfilled through the other channels. And that's really the only place we're trying to aim. I think we don't want to end up interfering or with the normal commercial market forces. And we don't want to offload a government responsibility if they're obligated to do it. And, so the gaps is always there. Sometimes it gets bigger or smaller, but that's basically where we operate in terms of the customer, as it were, non-paying.
Yeah, well, and I think we talked a week or two ago, and you made that distinction of, these, a lot of times these are, it's not like they're cannibalizing sales that a manufacturer would be able to sell to. I mean, these are people who need the supplies, but, they can't, there's no way for them to buy them. So that's a sale that would never happen, but they still need supplies. So I wanted to ask about, you guys do work in a ton of different situations. You said that you do sort of this ongoing work to make sure people have access to medical supplies just all the time. I know you guys also respond to sort of these disasters, like there's a hurricane or a wildfire or sort of these sort of, distinct geographic events. This last year, it feels like it's quite different from that. So I'm interested to know, like, how is responding to the COVID-19 pandemic different from the way that direct relief would respond to, sort of one of these more typical disasters we might think of, or a hurricane or wildfire type disaster?
Right. Well, it's a great question because over the past year, when COVID has arrived and, caused this greatest pandemic in 100 years, it also arrived during a year that was the worst year for named storms in the history of the United States and the third largest wildfire year in the western states. So, COVID brought on a huge set of its own problems, but it made virtually every other existing problem that much worse and more complicated. So, in general, when there's an emergency, what the difference in operations is in terms of speed and scale, not the basic function. FedEx and transport agencies, did they do something different during COVID? Not really. They had to step it up a lot. So I think it's roughly akin to what direct relief does. I mean, there's a chronic gap that requires humanitarian assistance that we try to fill through our activities. When it expands, as emergencies tend to cause an expansion of unmet need, there's a premium on speed and scale, but without sacrificing accuracy. So, I mean, we always try to just do what we do and do more of it faster. And remember that it's not, it's just not sending stuff to some place. It's really making sure there's an express demand, a person on the other end who's going to use it, that they're properly licensed and qualified, that it's within their scope of skills and practice, and it can be stored appropriately. And, that comes up a lot. And I happen to be in San Juan, Puerto Rico right now. And they had all those experiences with Hurricane Maria 3.5 years ago. Just the logistics challenges that arise in an emergency, it tends to simultaneously create a spike in demand and a contraction in the supply channels. If the bridges go out or so it's sort of the bad combination that occurs simultaneously. We're relatively accustomed to doing that. So you try to revert back to the first principles of, do you know somebody? Have you done it before? What are the workarounds that you can anticipate? And, we're used to, dealing in sub-Saharan Africa or in rural areas in Latin America. And, at times, although the United States is so advanced, so developed, and the richest country in the history of the world, we get flummoxed by these events. And we've certainly seen that even with something as relatively easy as the distribution of PPE during COVID in the United States. I mean, that is not a complicated product. It's not a heavily regulated product. It doesn't, you have to have it certified by NIOSH or FDA if it's a medical grade PPE. But it's most of it's a consumer good. And so, but, because it was not being driven by normal commercial activity through the normal channels, it became very chaotic. So we're sort of used to that. I think if that's a virtue. A lot of places we work are often chaotic. So we were able to do what we do and step it up to an extraordinary degree for direct relief. PPE on the one hand, but also making sure that the ongoing flow of medications through, direct relief's humanitarian accredited channel, you didn't want COVID to compound the existing problems of people who rely on a charitable source of their medication to maintain their health, whether it's for diabetes or hypertension or asthma, because those three in particular, if they are not managed well, can put a patient into crisis in a matter of days. So we tried to keep it as regular as we could through the systems that we use, but step it up in terms of speed and scale. And I think most businesses did the same thing.
Right. So I think that's a really interesting description. Like you said, it's basically the same thing, stepping it up in speed and scale, just a little bit higher stakes, but basically the same, operationally more or less the same thing that you normally do. I mean, do you feel like you learned anything over the last, 12 to 14 months that you think, we've learned something that this is now going forward, we're going to do things differently. Like, have you learned something, like has the pandemic changed the way you're going to operate in any way, or is it just kind of business as usual?
Well, certainly, unusual in that, typically a weather event or an earthquake or wildfires, it's geographically limited. So it is usually possible to mobilize from things that are not urgently needed in one place and get them to where they are needed. So, there's a change in status quo, and the equilibrium gets shifted. So again, spike in need, a contraction of supply channels, you've got to work around that. The pandemic has caused a simultaneously spike in demand everywhere, and so you can't really mobilize from one place to get it to another because needs are everywhere. And the supply, not just the supply channels, although those were compromised coming from China, those really got contracted, which early on when the pandemic broke out. But just the supply itself was unavailable. So demand was far outpacing supply with the contraction of channels. So I think, I'm not sure what we learned, except it's good to think about not just what has happened before, but what could happen, and think bigger. Because I think for this emergency in particular, COVID on top of the worst named storm season ever, a record wildfire year, the compounding nature of simultaneous events, you have to push yourself to think, think at a scale and think of scenarios that are beyond the norm, because these types of events are getting more frequent and more intense, just in terms of the weather events, for sure.
Yeah. Well, and that's just, I mean, in some ways I think that's realistic, but just considering climate change and kind of the way the world is changing right now, but at the same time, a little bit, dark in some ways like you were saying, to be prepared, you really have to think like, well, how could it be worse, and be prepared for that sort of worst case scenario. And unfortunately, the worst case scenario keeps getting worse and worse. So I wanted to talk about, you mentioned at some point in that previous answer, you were talking about how, you really don't, you want to be precise about kind of where you're sending, what you're sending. And it sounded like, and you talked a little bit before about doing that sort of demand analysis function. And so I'd be interested to know, like, you guys have this ongoing, you provide this ongoing support, just during normal times. And I'm interested to know how that ongoing work informs the work you do once there is a disaster.
Yeah, I think, well, it's not a static, it's a dynamic environment. I think people, if they need charitable help, they need it. And if they get a job and have, job tethered insurance, or now with the advent of insurance, that is something that takes it out of the realm of things that direct relief would normally do. But within a range, there's always been a chronic gap. There's still 20 to 30 million people who lack health insurance in the United States, for example. This is post-Affordable Care Act, everything else. And those people are in a tough situation. I think access to a health practitioner, primarily, access to medications follows that. But, you can model, I think, within a range and get some aggregated sense of, well, how many infections are going to need this? How much diabetes is unmanaged among people who lack insurance and are low income? And so modeling is helpful. I think, we prefer to just work on aggregating essentially, requests or purchase orders if it were in business. But you've got to step back and try to make sense of what you're seeing, what the underlying trends are. So we try to do as much of that as we can, the demand analysis, not in the moment, but over time. And you can see, it ultimately gets down to brass tacks and how much you can send of what to someone who orders it and it's an approved order. But we spend a lot of time trying to figure out how we can forecast what is likely to occur with some lead time to put people on notice if there are, you have collapsing countries like a failed state like Venezuela that was a thriving economy. Now it's just wrecked. I think the commercial markets collapse. But there's 30 million people there who are in crisis, and there's a humanitarian imperative that, we try to stay out of the political fixes, and we're an apolitical organization. So we look at that very carefully and try to take as many measures to size both the aggregated demand, match it up, and then have an informed conversation with, we can, if it's a medication, you can only send it to a person who's authorized to receive it in the country in which they're working. So it's a relatively limited channel, but it's a huge issue. I think we struggle with that in the United States. Highly evolved, forecasting models and all sorts of real-time kind of signals that come in through consumer demand. And we still, don't get it right all the time. We still have shortages. We still have excess. So there's probably a higher degree of error just given the nature of what direct relief does. But we are trying to basically use all the tools to assess demand, make an informed decision, because we don't want to ask someone for a product that, unless we're confident it's going to be well used by someone who would not otherwise buy it. So it's a bit of it's an analytical challenge, but we have a lot of tools, and we run SAP, which generates a lot of data, so we can look at historical records, recent records, and try to pull that signal out and make some informed decisions.
Yeah, that's, always difficult to predict exactly what the future is going to be. But it sounds like you guys have a lot of tools to try and figure out what's most likely going to happen and respond to that. So I wanted to ask too, because you guys are approaching this, I know you work really closely with commercial companies, and when we talked a couple of weeks ago, you told me you guys often sort of follow the same sort of channels that commercial companies do. So there's really sort of an integration with what you do and what commercial companies do. But I'm interested to know, if you were sort of to give advice or give a lesson to commercial companies that, what's something that maybe you've learned in the nonprofit space that maybe that is a lesson that could benefit commercial companies in the healthcare supply chain?
Well, I think we start from a different set of expectations, and we were looking at very low resource environments where, I think if you penciled out what it would cost through whatever the best practice is commercially, and there's no return on the other end, it doesn't work, right? So how do you bring on nonprofit organizations, you really are looking at the expense side of the ledger where you can control things much more than the revenue side where you can't. We're a public charity. We rely on, we're not selling anything. We're hoping that people are in a position and think well enough of direct relief to support us. But we're constantly looking at how can it be done less expensively. Cold chain is a good one for now. I think the shippers themselves, all the packaging materials, the refrigeration and the temp tails or the data loggers that have to go along to ensure integrity of a cold chain product, a pharmaceutical product, they're expensive. So we're looking at how can we optimize the packaging? How can we work with the packaging manufacturers? How can we do analysis of where the lanes are? So we've had to do some lane analysis, kind of a shipping lane analysis for cold chain that no commercial company would ever do. It's going to places that are not commercially attractive, but we've learned a lot. And I think we can share that with commercial actors and anyone else, because I think the more there is a commercial activity, costs do tend to come down and quality tends to go up. But the big dilemma of our time is, I think, Matt, that we do things better and more efficiently and faster and cheaper if there's a commercial reason to do it. right? If there's just a non-commercial reason to do it, it kicks it to governments or nonprofits, and then people get frustrated when the activity is not done as well as they know it can be done if they look up something, click on it, it's at their house in an hour or at least the next day. So we know it's possible as consumers, and so it's conceptually possible in the area of humanitarian or public benefit activity, but the economic motivations are just much, much different.
Yeah. Well, and it sounds like part of what you're saying is you guys can sort of blaze a trail where, a commercial company might look at something and say, to get this product to this place, like, not going to be a huge return on investment. It's going to be a huge amount of effort to figure out how do we even get it there. But you guys feel like, we're going to try and get it there regardless of whether we make money from it. And so if you figure out an efficient way to get it there, then suddenly in the future, maybe there's a commercial opportunity arises there because of the work that you did. Exactly. It sounds like part of what you're saying. Yeah.
Yeah. Necessity is supposedly the mother of invention. And so it's necessary to think of something different when the best thing you got today clearly isn't going to work on a sheer cost level. So I think that's what we look at aggressively, and as do businesses. But I think at some point, they're expecting some return, and we're really not. But we are focused on how to do it as efficiently and cheaply as well as possible. With the quality that's necessary when it comes to a medical good.
Yeah. So this is going to be my last question. I try to ask this of everybody I talk to, but if you had one wish to change the way that the healthcare supply chain works, total magic wand, you can do whatever you want. You only have one wish. What would you change?
Only one.
Only one. I've had people try and do more, and I have to hold them back.
Standardized, uniform data on a free platform for all.
On a free platform for all. Interesting. I hear transparency a lot in response to that question. And it's interesting to think about sort of the availability of that information too.
We can all make better informed decisions if we have good information, and there's a lot of private information that drives private companies, and competition for having people work on your platform and not someone else's. So I think it can add costs that in our space are a real challenge. Yeah.
Great. Well, Thomas, thanks for joining me on the show today. This was a super helpful conversation for me. I really enjoyed hearing about the work that you guys do and hearing some of those insights. So it was great to talk with you. I hope the viewers got a lot out of it too. This has been Medically Necessary. Thanks for watching. You can watch the next episode on Thursday.